Welcome to the McLean Hospital Crafting Support Project 2025 Family Webinar Series. I'm Dr. Julie McCarthy, and I'm a clinical psychologist and researcher at McLean Hospital. Tonight, I'm very excited to have you with us for a presentation on supportive parenting for anxious childhood emotions, or SPACE, with Dr. Eli Lebowitz from the Yale School of Medicine. Before we begin, I'll go over a few reminders. So folks are welcome to change their names for privacy, as you make any questions or comments in the chat, to do so anonymously. And please enter any questions that you might like answered in the Q&A box, and we'll be answering questions at the end of the presentation. And we ask that you do use the polls and chat for audience participation when appropriate, and to share any comments or resources that you might like. And we'll be recording the presentation and Q&A discussion, and when recordings are available, we'll let folks know. And to continue to improve our webinar series, we encourage everyone to complete a brief anonymous, completely voluntary feedback survey to share your thoughts, preferences, and ideas for future webinars as well. So this information really helps us for quality improvement and may be shared anonymously with researchers in the future or folks who are interested in expanding these types of supports for families. So I'm going to put that in the chat for anyone who might need to run in the before the end of the presentation. Okay. So for our agenda today, I'll give a brief overview of the Crafting Support Project for those who might be newer to it. Then we'll move right into our presentation on SPACE. And then the last half of our time tonight, we'll have a live Q&A with Dr. Lebowitz, and then we'll end with some closing remarks and resources. Okay, so before we get started, let's see who all is with us today. So I'm going to put a poll up for everyone to take a look at in just a moment. Okay. So what I'd like folks to respond to is this poll on what best describes your role currently. So our options today, and you can click more than one, I believe, is family member, person with lived experience with mental health challenges, clinician, or perhaps none of the above. Maybe we're missing a category as well that we might want to consider. All right. So you've got most people entering a response. If anyone else would like to get a response in there, we'll be closing the poll in 3, 2, 1. Okay, so I'm sharing the results now, and it looks like we have 71% who are family members with us today, about 29% who are clinicians, and 8% are people with lived experience with mental health challenges as well. So welcome, and thanks so much for being here. Okay. So if you're here today, you might be wondering if this is a new webinar series for you, what this is all about. So the Crafting Support Project Family Services at McLean Hospital really started from myself being in a position where I had been asked, by people, what do I do if I have a loved one who needs help, but they may not rise to the level of requiring help or needing a hospitalization, but they could still benefit from treatment. And earlier in my training, I didn't always have the best answer to that. And so since then, I've learned a lot about different approaches, evidence-based approaches to helping families help loved ones get into treatment, make the most out of treatment, and also help themselves out in the process. And so we've been very fortunate to receive philanthropy funding to offer this webinar series. And so this year we have a great lineup of folks ranging from different types of experiences, like anxiety, psychosis, et cetera, and then also other different social factors, environmental factors like housing on our agenda as well. And for people who have missed some of the past webinars that you might be interested in, feel free to check out our YouTube channel where we have all of our recordings posted thus far, including the one from April on supported employment with Dr. Kim Musser. We also offer free one-on-one coaching to McLean families currently, which is up to 8 weeks of one-on-one sessions with a coach like myself, all on Zoom. And this is offered at no cost to folks currently, and we are in the process of gearing up to do an insurance-based version of this program for folks who may not necessarily have interacted with McLean before, but who live in Massachusetts. So feel free to get in touch if you have any questions or interest about that. All right, and in just a moment, we'll be turning over the presentation to Dr. Lebowitz. And a little bit about him. Dr. Lebowitz is a psychologist and associate professor who studies and treats childhood and adolescent anxiety at the Yale Child Study Center. His research focuses on the development, neurobiology, and treatment of anxiety and related disorders, with special emphasis on family dynamics and the role of parents in these problems. Dr. Lebowitz is the lead researcher on multiple funded research projects and is the author of over 100 research papers, books, and chapters on childhood and adolescent anxiety, including the book Breaking Free of Child Anxiety and OCD, in addition to being the father of 3 great boys. And so to get a sense of how familiar people are with this SPACE approach, I'm going to launch our last poll. So if you don't mind, please feel free to answer the question, how familiar are you with supportive parenting for anxious childhood emotions, or SPACE? 0, not familiar at all. 1, mildly familiar. Maybe you've heard this term before. 2, moderately familiar. You've looked into it, read about it a bit. Or 3, very familiar. Okay. All right, so we'll close out the poll in 3, 2, 1. And it looks like kind of an even split for a lot of folks. So about a third of people are learning about SPACE for the first time. So thank you so much for coming. This is a great spot to learn about that. A third are mildly familiar, a third are moderately, and we have a couple of people who have participated in SPACE before. So thanks so much. And yeah, we welcome having folks who are experienced in this area too. So I'm going to stop sharing my screen so Dr. Lebowitz can start sharing, and feel free to take it away.
Great, thank you very much, Julie. That was really interesting. I didn't know you were going to do that poll. That was actually really interesting to me to see. Well, thank you for having me. Thanks for everybody for coming. I'm going to bring up some slides on my end. Hopefully that is up. And I'm just going to jump into talking about child anxiety and related problems and SPACE in particular. So these are just a reminder of the main anxiety problems that we're usually diagnosing in children, adolescents, actually pretty much holds for adults as well. Specific phobias, panic disorder, which is basically having intense panic attacks kind of out of the blue and being very preoccupied about having more of those attacks. Agoraphobia, which is where you avoid situations because you think you might have some anxiety-related kind of physical symptoms like a panic attack and you won't be able to leave easily, or maybe it'll be embarrassing in front of other people. Generalized anxiety, which is essentially chronic, intense and interfering worry. Social anxiety, which is largely self-explanatory, just the intense preoccupation with social evaluation. Separation anxiety, fear of being away from attachment figures, caregivers, basically parents in most cases. Obsessive compulsive disorder, I am lumping in here with the anxiety disorders. And a more recent addition to this group is illness anxiety, which is an overpreoccupation with things to do with being sick. And those are really the main anxiety problems. Taken together as a group, the anxiety disorders are the most common mental health problem in kids. And really, even in the best of times, these are exceedingly common problems, with estimates of around maybe 1 in 3 kids having an anxiety disorder at some point before they reach adulthood, and maybe 10% having an anxiety disorder at any given time. But that's even in the best of times. I think it's hard to deny that the past few years have not really been the best of times. We've lived through a pandemic and other forms of unrest. And those are things that are almost engineered to create more anxiety. And in that sense, they have been very successful because we have seen real escalating rates of anxiety in kids ever since the pandemic. And even though the pandemic itself has largely receded from most people's lives, those rates have not, at least I have not yet seen data to indicate that those rates have come back down to their pre-pandemic levels. And so we basically took the most common mental health problem and boosted it even further. And so we're talking about extremely common problems. Now, for a long time, meaning about, say, the past 50 years or so, there have been primarily two forms of treatment for anxiety that have garnered the most support in terms of research showing that they're effective. One of those is cognitive behavioral therapy, which is a treatment you would do directly with the child and focuses on doing things like exposures to the things that you fear or trying to adjust your thoughts to be less anxious thoughts. And the other treatment has been medications, primarily and confusingly, the antidepressants. That is confusing because we're talking about anxiety, but antidepressants are also the medication of choice for treating anxiety in most cases. And actually, anti-anxiety medications, which you would think would be the choice, are usually not the treatment of choice for treating anxiety in kids or even in adults. And so usually it's antidepressants like the SSRI family, the Prozacs of the world, sertraline, et cetera. Now, there's a lot of clinical trial data, many clinical studies that show that these treatments are effective. However, those clinical trials also show that they're not effective for everybody. If you were to boil down all of that data from those like hundreds of studies, it points to the conclusion that a child who gets one or even both of those treatments has about a 50% chance of doing really well. Maybe that means full remission. They don't have an anxiety problem at all anymore. Or in another 10 or 20%, there'll be partial response, meaning they got better, but they still do have an anxiety problem. It's just significantly better than it was, which is still a big deal, right? Like that's still a very meaningful, impactful thing for a child's life. But those numbers also make it obvious that there are a great number of children who are not really responding or responding sufficiently to these treatments. And it's also important to realize that there's a little bit of sleight of hand that can happen unintentionally, but there's a little bit of sleight of hand that can happen because if I say, you know, let's say 70% of kids will have at least partial response, well, actually, that's not true. It's not that 70% of anxious children will respond well to these treatments. It's only that 70% of the children who do the treatment in the first place will respond well. And that's not every child, because not every child is an optimal candidate for therapy in the first place. Some children don't want to do treatment. They definitely might not want to do cognitive behavioral therapy, which includes those exposures. Or they might have other problems that just make it really hard for them to participate in a therapy like that, like verbal and communication issues, behavioral issues, etc. And also for medications, not every child wants to take a medication. Likewise, not every parent wants to give their child a medication. For both good and not good reasons, parents tend to fear psychiatric medications more than any other class of drug. And that means that not every parent is going to be giving their child a medication. So it's not that 50% of all the kids respond or 70% of all the kids respond. It's only of those who do the treatment in the first place. But either way, it obviously means that there is still room and need for additional treatment options. How can we improve these outcomes? And for a long time, people thought about the option of working with parents. And they did a lot of studies over the past like 30 years or so. There were a bunch of studies, like 24 or so, that asked the question, well, if we don't only treat the child, but we also work with the parent, will we do better than if we only treat the child? And I think most people would, if they had to bet, would put their money on, yes, we will do better. I would have put my money on that as well. That is not what the data showed. So you have all these studies, and when you synthesize the information from those studies, what they actually show is that adding that parent work did not really make much difference. Surprising, frustrating, a little puzzling and disappointing, but it makes you think about, well, is there some other way that we could be working with parents of anxious children? Typically, the way people worked with those parents when they wanted to do that thing of like, let's add a parent piece, what they did was to try to make the parent be a therapist for their child. So maybe the child is going to cognitive behavioral therapy. They're doing exposures or what have you. And then when you meet with the parent, you teach them about exposure so that they can also go home and practice this with their child, or other parts of the treatment. And it turns out that that approach doesn't really yield the kind of benefit that people were hoping for. There's also another disadvantage to thinking this way, which is that if you conceptualize the work with the parents only as an added on layer on top of the child's therapy, well, that means all those kids still need to be in therapy. And all of this really led to a lot of thinking about other ways to work with parents and about parent-only treatment. And that's really where I want to come to talk about SPACE, which takes a very different approach to the work with parents of anxious children. And the truth is that that approach is rooted in a very simple fact, which also gives me the opportunity to show my favorite slide because it has a lot of very sweet images on it. But what all of these images have in common is that they're all pictures of mammals, or videos, I guess, of mammals. And the point here is that we are also a mammalian species. And that really matters when you think about child anxiety and when you think about the role of parents in the context of a child's anxiety. Why does it matter that we're mammals? Because in mammals, the immature mammal of all the mammalian species, the immature mammal actually responds to fear in a way that is different from the mature mammal, right? Like if you think about our species, humans, if you were to frighten an adult, like you walk up to, don't do it, but if you walk up to somebody and scare them, they have a kind of classic fight or flight response, right? They might confront you, they might get away from you. But if you were to walk up to somebody's baby, immature mammal, and scare them, well, they respond differently. I'm not encouraging you to test this out, but we all know that babies and children respond differently. And the way that they respond is actually not by what you might think of as like a direct fight or flight approach, right? Like they're not going to confront you because they're children, they're small, they can't. And if it's a very small baby, they're not going to run away either because babies are not very good at that. What the baby will do is cry. And that means it is going to be sending out a signal to somebody else. It's basically crying is a way for the baby to alert the parent to say, hey, this creep is scaring me and I need you to protect me. Essentially, instead of like fight or flight, you could think of it as fight or flight by proxy, right? Like my anxiety system is being triggered and its response is designed to trigger your anxiety system, you being the parent, so that you can step in and protect me. And that's a really important insight because if you accept that, if you accept that in a young, immature mammal, fear is essentially a social response, an interpersonal response that doesn't just involve the child, but involves also the parent, well, then it also makes sense that if a child has a disorder like an anxiety disorder that is characterized primarily by chronic fear, Well, inevitably, what is going to ensue is chronic activation of the interpersonal system, right? It's always going to be activating this interpersonal system that involves the child and the parent. That means that a parent, in the context of a child's anxiety disorder, is not just a bystander, right? They're not just another person who happens to be around. They are part of what it means for a child to have an anxiety disorder. I don't mean by that that the parent is causing the child to have an anxiety disorder. This is not about, like, children have anxiety because their parent is too much like this or too much like that. It's just built into our species that if you have chronic anxiety, it's going to chronically involve your parent. And in fact, when we look at families of children who have a lot of anxiety, what you see is tremendous levels of parent involvement in those children's symptoms. A word that we use very commonly to describe that involvement is the word accommodation, meaning the parent is responding to the child's anxiety in ways that are trying to help the child not be anxious, right? Like, my child has separation anxiety. Well, I'm going to respond to that. Maybe I don't go out in the evening. Maybe I do sleep next to them at night in bed, because they have separation anxiety. So I'm accommodating that anxiety because that's how I'm hardwired. If my child is anxious, I have all of this brain circuitry that's telling me I need to do something about it. I'm supposed to make them feel better. I'm supposed to help them not be anxious. My child has social anxiety. So maybe I do speak in place of them in social situations, or maybe I don't invite guests to my house because I know that it would make them anxious. And you can go through any anxiety symptom or disorder that a child might have and see all, like, you could even just think yourself about all the different ways that a parent might find themselves accommodating that child's symptoms. In fact, a lot of research all around the world shows that close to 100% of parents who have an anxious child do accommodate on a very regular basis. Usually that's daily, often many times a day. But that research also shows another important thing. And that is that even though the accommodation is a generally well-intentioned, well-meaning behavior on the side of a parent who is bending over backward to help their child not be anxious, what the data show is that, in fact, as a parent accommodates more, a child tends to get more anxious. In the moment that you accommodate, you're bringing the anxiety down. But over time, as you accommodate, that child tends to get more and more and more anxious rather than less anxious. And I think part of the reason for that is that while it's true that you're kind of rescuing them and helping them to feel better in that moment, they are also reaffirming for themselves the most pernicious anxious belief, which is the belief that I can't be anxious. It's not okay for me to be anxious. I can't handle that. That's not something I can cope with. And if you believe that, well, you are going to be more anxious because you're so committed to not feeling anxious that you're trying so hard to avoid it. And that leads to more anxiety over time. And that is definitely what the data show. Almost every parent of an anxious child accommodates. And the more you accommodate, the more severe and impairing your child's anxiety tends to get. So all of this really informed the treatment that I developed called SPACE, or Supportive Parenting for Anxious Childhood Emotions. And SPACE, unlike the work that I described earlier, is a completely parent-based approach to treating child anxiety, OCD, and increasingly some other problem areas as well. And when I say it's completely parent-based, I actually mean two things by that. One is it's just the parents who have to go to the treatment session. So the child does not have to go. In fact, you can do SPACE and do it successfully, even for a child who adamantly is opposed to the idea of treating their anxiety, which is something you can't really say about any other anxiety treatments that I'm aware of. And so it's parent-based in that sense, that it's only the parents who are directly involved. But there's another way in which it's parent-based. And that is that throughout the whole treatment, all of the focus is never on trying to get the child to change what they're doing, to do more of this, do less of that, do more exposure, do more breathing exercises, none of that. Instead, all of the focus is on changing the behavior of the parent themselves. Because we just kind of defined anxiety as a system. And in a system, when one thing changes, everything tends to change. When one thing gets worse, everything tends to get worse. But when you can make a change for the better, that tends to affect the other parts of the system as well. And that means that parents don't need to put their energy into trying to make their child do things like, come on, do this exposure, which often backfires because your child doesn't want to and you get into a fight. Instead, they can simply focus on changing the way that they are responding. And there are two changes that we try to bring about with parents who are doing SPACE. One of them is to be more supportive in response to their child's anxiety or distress. The other is to be less accommodating of their child's anxiety. Let me describe what I mean by more supportive. That's a word you could, I guess, understand many different ways. In SPACE, we have a very specific definition. We would define a supportive response as any time that you, as a parent, are responding to your child's anxiety in a way that shows them two key messages. One is simply a message of acceptance and validation, meaning, I get it, it's real, this is how you feel, it's not fake, it's not, I'm not belittling it, I'm just validating that that's your experience. But acceptance by itself is not support, it is acceptance. It becomes support, per the definition we use in SPACE, when you combine it with the other message, which is confidence, a vote of confidence that you as the parent have in your child's ability to tolerate some anxiety, to cope with feeling some distress, to get through that, survive it, maybe not gracefully, maybe not prettily, but it's not a demand of the child to cope. It's simply an expression of the parent's belief that their child can cope. That's all it is. So it might sound as simple as saying to your child something like, I get it, this is hard for you, or I get it, this makes you anxious, and I believe you can handle that. Then the child says, well, no, you're wrong, I can't handle that, and you just leave it and say, well, that's what I think. That's it. No argument, there's no demand at all. I honestly make a simple promise to parents. Usually in the first session, if I'm working with a parent, I'll say to them, at no point in this treatment am I going to ask you to make your child do anything or make them not do anything. And that includes agreeing with you. They don't have to agree with you. You just are going to focus on you. You're going to say what you think and leave it at that. And so parents in SPACE really learn and practice these supportive messages. And then the other focus of the treatment is on those accommodations that I was describing before. Now, the message in SPACE is not, okay, just stop accommodating. That I don't think is a practical or kind of doable message for most families. And honestly, probably would be overwhelming for most anxious children if a parent just stopped all of their accommodations overnight. But even if it wasn't overwhelming, most parents would not be able to do that. Instead, what we do is spend some time mapping out what are the different ways in which you are accommodating this child, and then choose one specific thing. And then on that one specific thing, we'll make a really detailed plan for how you're going to change it. Are you going to stop it completely? Are you going to maybe just reduce it partially, take a gradual step? We'll make a really clear plan. We'll also let the child know about that plan in advance. In my experience, child anxiety and surprises do not make the best cocktail, and there is no benefit to taking a child by surprise. And so we'll explain to the child what we're doing, and we'll also explain why we're doing it. And then parents will start to implement those plans to reduce the accommodations. And after they've successfully reduced one accommodation, they might do it again for a second one. Usually when you're doing SPACE, by the time you've worked through 2, maybe 3 different accommodations, actually the child is doing so much better that you are able to stop treatment. Now, the fact that you tell your child in advance in a really supportive and very loving, positive way does not guarantee that your child will applaud your decision, embrace you, and congratulate you on your excellent parenting. Sometimes when you begin to reduce accommodation, a child will respond with some difficult responses, right? They might say, they might get really mad at you, and that's hard. Or they might get very distressed, because they're anxious, or they might say, you don't love me anymore, or other difficult things that can be hard for a parent to deal with. And that is why SPACE also includes a set of tools for how are we going to cope and navigate with those challenges in a supportive, positive way, but one that will also allow us to continue the treatment. And that is really the smallest possible nutshell for describing what SPACE is. There are multiple randomized controlled trials of SPACE, and they show really good efficacy of this treatment approach. In fact, the effectiveness or the efficacy of doing SPACE is no worse than the efficacy of doing a treatment that works directly with the child, like cognitive behavioral therapy. Or some families might choose to do both things. Maybe the child is doing CBT with their therapist or another treatment, or they're getting a medication, or something like that, and then the parent might be doing SPACE as well. And so you can also combine both things if you choose to. This is just a chart from another randomized control trial. This study, I encourage you to actually read the paper if you want to know all the details, but it actually shows that parents can have good success even with relatively low levels of therapist support by working with a book that I wrote. I didn't do this study, but I wrote a book that is a book for parents to be able to use SPACE on their own. And in this study, what this team did is, for some families, they fully did the therapy every week, meeting with a therapist, and the other group, they gave them the book and encouraged them to read every week, and they only checked in with them about once a month. And actually, both groups did really well. The ones with the full therapy did a little bit better, but both groups actually had very good outcomes, and not all that different from each other. In my last, I know I'm going slightly over the time I was told to do, but in my very last 2 minutes, I will just mention, we've also been working to kind of expand who can benefit from this treatment. This is Judah Kohler is an autism researcher, has done the first clinical trial showing that you can do SPACE for anxiety in children with neurodivergence, with autism. Yara Shimshoni did an adaptation, or with me really modified the treatment protocol to be a treatment for another problem that kind of relates to anxiety, but is also different, which is what the DSM calls ARFID, or avoidant restrictive food intake disorder. This is what normal people call very picky eating. And we were able to adapt and translate this treatment into working with parents of exceedingly picky eaters who are really impaired by the condition. Dr. Berger did work with me on an adaptation of SPACE, actually going from the world of children into the world of adults, but working with parents of adult children who are not functioning as independent adults, what is sometimes here in the US referred to as failure to launch. In other countries goes by different names, but it's basically that adult child who is not independent at all, still living with parents, not working, not in school, not doing anything, really stuck in life. And so we were able to adapt SPACE for that as well. Finally, Dr. Etkin worked on an adaptation of SPACE for parents of children with chronic physical symptoms, chronic fatigue, chronic pain. What these different problems all share in common is these are common problems where parents are heavily involved in the child's symptoms with high levels of accommodation, and also problems where sometimes the child's own motivation for treatment is not quite so high. So I don't want to take up more time. These are some books that are relevant to SPACE. The one on the left with the blue cover is actually the book that I mentioned that they used in that study, which is really a step-by-step guide for how you could do SPACE on your own. It also ends up being a good tool for therapists who are working with parents as a kind of guide to how they might do this kind of work with a client. Finally, if you want to learn more about SPACE, go to spacetreatment.net. Spacetreatment.net. You have it there on the screen. That's like a website devoted to this treatment. It includes, by the way, a list of therapists. There's over 3,000. There's at least one in every single state in the US, although I probably guess where most of you are from, but there are definitely a good number in your area and or Massachusetts, and you can search and find a therapist where you can learn more about the treatment. Or if you're a therapist and want to get trained in this treatment, then you can find information on training. So thank you so much for giving me this chance to talk about some of this work. Thank you all for being here. Thank you, Julie. And I'm happy to try to address any questions that might have been coming up along the way, if there were.
Great. Thank you for that amazing overview of SPACE. I really loved how you described the program, and thank you so much for including the resource at the end, because I'm sure many of the folks on our webinar are probably wondering, how can I get my hands on some SPACE support? So thank you for that. So I'm going to address a couple of the questions that came through the chat. If anyone else has questions too, feel free to put them in the Q&A or the chat. So the first question is, say if parents are using SPACE, but they have their child who's saying, well, if you really understood how I feel, you wouldn't be asking me to do this. And I know you said that you're not really having parents ask people, or having SPACE have parents change what their child is doing. However, in the course of being a parent, they're probably asking their children to do things as part of life. So any suggestions on how parents could potentially respond to that pushback?
Yeah, I think you have to be willing to accept that there can be some pushback, because your child is used to one way of, how do I get myself to feel better when I'm anxious?
Mm.
And it may not be the ideal way, but it is the way that they're used to. And so this can feel hard. And so, I'd start just from a place, a lot of empathy for that child who is pushing back. They're not being bad, right? They're being human, they're being normal. That's to be expected. But I also know from a lot of experience that when you are able to not engage in an argument, not try to change their mind and fight with them about it, you stick to your plan, that resistance is soon replaced. And it's replaced with hope. Because, always having somebody to rescue you, that's a great thing. But always needing to be rescued by somebody is a very vulnerable way to live your life. And when you start to realize, I don't need that, I actually am okay, you start to feel a lot more hopeful that maybe you can get over this problem. And so, in the same way that if you were, I don't know, if your child was addicted to junk food and you decided to take it away, you would expect them to push back because you've been giving it to them every day, right? Like, they have every reason to expect that you'll continue to do it. And of course, they're going to push back and say, why aren't you? But you're doing something that's positive, and you also think, pretty soon they're actually going to feel better.
Mm-hmm. Thank you so much for that response. So another question came up, and I think it speaks to your point about how you can do SPACE in conjunction with something like CBT or cognitive behavioral therapy. How would you say we might apply the acceptance and validation with confidence to provide support in the context of perhaps having a parent assisting in facilitating an exposure with their child? Because that might come up as well.
Yeah, well, I think if you are doing both treatments at the same time, then it probably makes sense for the exposure-based work to be with the child, like have the therapist do that with the child. They give them the homework or they do the exposures in the session. I think, and have the parent just focus on the parent side of it. I think it's hard as a parent to be doing CBT to my child and also be doing SPACE to my child at the same time. That feels like it would be very tricky. That being said, I think a supportive response is going to work well for most situations where your child is coping with some distress that is not a true danger to them, but is difficult for them. And that's true even for kids who don't have an anxiety disorder, right?
Very
Like
true.
your child is dealing with a school-related stress and a big test, or they're dealing with a social thing or girlfriend or whatever.
Mm-hmm.
Honestly,
Mm-hmm.
in most situations, a simple supportive response, like I do understand the difficulty, I do have the belief that you can handle that difficulty, you probably won't go too far wrong.
Yeah. Okay. Thank you. And so another question that had come up was, you know, how how do you feel like people could maybe use this as parents who might also be struggling with anxiety themselves? Because some of this might be
Yeah,
familial or heritable too.
yeah. Well, I'll put it this way, like slightly facetiously, but I'd say if we developed a treatment for child anxiety that only worked when the parents are not anxious, we would have a treatment of somewhat limited utility. We take for granted, of course, the parent is, in many, many cases, also going to be anxious, whether because of hereditary anxiety or even for other reasons. Of course, many of the parents are going to be anxious. Actually, by the way, our clinical trial data actually indicates an improvement in parent anxiety
That's a
following,
huge benefit. Yeah.
yeah, following doing SPACE. That was not our stated goal, but we measured it, and we do see actually significant improvement in parent anxiety. Now, sometimes that means that this treatment has to progress a little bit slower. Sometimes you, as the parent, will need more in the way of tools, and that's part of doing SPACE. This is a 20-minute talk. I'm not able to fully go through all the process of
Of
doing the
course.
treatment, but there is a lot of work is put into how are you, the parent, going to handle those situations? How are you going to
Mm,
stay calm? How are you going to regulate yourself in those moments? Because yes, that is going to be part of the challenge, but hearing yourself say those supportive statements to your child and
mm.
actually starting to take, even if it's a small step, and seeing that actually your child does get through it, that has a big impact on your anxiety as a parent, as well.
Hmm. And I think this is kind of a question along the same lines. What might be a couple of reminders that parents could kind of keep in mind as they're going through practicing SPACE to encourage them to stick with it? Because it sounds like part of this process, like with even exposure in and of itself, is to kind of do this repeatedly until you
Yeah.
start seeing more results. So any one or two things that you've had as recommendations or that parents that you've worked with have found helpful?
Yeah, well, I'd say a couple of things. I mean, in terms of things to, say to yourself, I think it's important to just remember, yes, I'm doing a hard thing,
Mm.
but this is my way of helping my child. SPACE is not about helping your child less. Sometimes like it's easy
Takes
to
more work.
right? It's like it's easy to misperceive it that way because it's like, oh, I'm drawing back on the accommodations, but it's not about helping your child less. It's about helping your child differently.
Mhm.
It's about helping your child in a way that would help them to get stronger. It's like if your child has weak muscles, you can help them by just carrying them, but those
Mhm.
muscles stay very weak.
Such a
Or
good
you
point.
can help them by allowing them to strengthen the muscle, which might mean a little bit more pain along the way, but
Mhm.
ends up soon with a child who is stronger and ultimately does ease the burden for you. In the end, maybe in the first weeks, SPACE makes your life harder as a parent. But after a few months, actually, it's making your life easier because all of that accommodation does put a lot of burden on parents. We
Mhm.
also do really encourage parents to be monitoring their implementation of what they're
Mm.
trying to do,
Mm.
not just make a plan, but make a plan for how you're going to be keeping track of your implementation of your plan. Just think of all of the apps and the devices that exist in the world to provide monitoring to people, right? Like you wear a Fitbit. Why? Because the monitoring, it telling you you walk this many steps or that many steps,
Mhm.
monitoring tends to help you to stay adherent or compliant with your plan. It doesn't only tell you whether you did, it actually helps you to do it. And so we do encourage parents to do active monitoring along the way. But we also
Mhm.
try not to take over ambitious plans that are more than a parent can follow, right? It's
Sure.
better to take a smaller plan and stick to it than to like try to do everything.
Yeah.
So there's just a few, kind of thoughts about it.
Yeah, thank you so much. So we had a couple of questions about, I think, one of the adaptations in some ways that you were getting at with SPACE in
Mhm.
terms of how this applies to adult children, perhaps, whether it be failure to launch or adults with anxiety. So in what age range has this been studied in people who are perhaps 18 or older?
Yes. So space in the way that I was kind of describing it has been studied in through the school years, meaning like from
Mhm.
actually preschool years, actually even
Mm.
preschool years,
Mhm.
3-year-old, 4-year-old, and all the way through 17.
Mm.
And then in the adult children, we tested the version of space. It is a little bit different. It is a little bit different, but the DNA is the same. And there were all ages. A lot were kind of young adults, like in their 20s and things like that, but
Mhm.
also even significantly older than that, because
Okay.
that failure to launch phenomenon doesn't have like a natural expiration date. It can just
Sure.
continue for many years, and so some of them were actually even quite a bit um, older than that.
Mhm. Okay, thank you. And so this is sort of a related question, and a couple of people were getting at this. So I guess for whom, if anyone, would space maybe not be appropriate, whether it's a specific age range or if it's a specific co-occurring concern or a
Mm,
specific risk level, like if someone's also expressing suicidality.
yeah.
Yeah, where do you feel like there might be a boundary drawn, perhaps, or a
Yeah.
reconsideration for that?
I guess what I would say, usually for me, it's not about like a clear contraindication, but it might
Mm,
be like give me pause, or
yeah.
like here's a
Okay.
place to be really thoughtful and like do some case by case decision.
Mm,
So what are some of those situations? First of all, I will say we have not tested space as a standalone treatment for post-traumatic stress disorder, which is
okay.
also an anxiety related problem. But if your child has PTSD, I don't mean there's a history of trauma. You could have social anxiety and there's a history of trauma, and then I think doing space is fine. But if the problem you're treating is PTSD, I can't recommend only doing space, at least until I see some research to suggest that that is sufficient.
Mhm.
So that's one just thing to be aware of. Other things to be aware of. First of all, it does require a certain amount from the parent. And so, yes, it's fine for parents to be anxious, like we said. It's fine for parents to have some of their own depression. Many parents do, and that's oh, I mean, I don't mean to say it's okay. That sounds callous, but I just mean it's not a reason not to do space. However, if you feel already way underwater
Mm,
and not underwater just with dealing with the child's anxiety, but with your own problems, or maybe if this is a moment in your life where other really big things are happening, you have a surgery coming up, you have a move coming
mm,
up that you house, maybe it will not be a good time for you to try to also do this treatment for your child as the parent, and maybe you decide not to do it right now. I think if I meet a parent where I have serious concern about their understanding of what is an appropriate behavior with a child, what is appropriate discipline, what is appropriate, like their judgment as parents just seems to me to be significantly problematic,
mm.
then I will be hesitant to do a treatment strategy where I never see the child,
Right.
because
I see.
that can become problematic. I feel like, with these parents, I need to be keeping an eye, a finger on the pulse or an eye. I'm not even saying don't do space. Maybe they really could benefit from learning better ways to respond. I
Mhm.
might say, look, I don't think it's not responsible for me to just see the parents and not see the child at all. Um, yeah, I mean, I think those are some of the things that come to mind in terms of times I would be cautious.
Gotcha. And also,
Oh,
there,
I'm sorry, you mentioned suicidality. I will say,
yeah.
you I think you can do SPACE. In fact, it actually does include some tools for how do we manage some of like suicidal threats that a child, some
Right.
children, you don't accommodate, they'll say, well, I'll kill myself. And that's their
Yes.
way of forcing your hand. And
Mm-hmm.
that is baked into the treatment and we can address it.
Okay.
However, if a child is presenting and they are actively suicidal for other reasons, then probably there are other treatments that are going to be indicated.
That makes sense. Certainly, anxiety doesn't always exist in a bubble.
Yeah.
And so, along those lines, too, how would you say that, um, you know, I guess beyond the adaptations that you've already made for different co-occurring concerns, whether that be physical or mental or developmental otherwise, any other considerations about or potential opportunities that you'd be excited about for thinking about working with folks who have anxiety and other co-occurring mental health conditions?
Wait, I want to
Like,
make sure if I'm understanding the question. Sorry,
mhm.
but help me understand the question a little bit
Sure.
better. Sorry.
So, someone was asking about, how you might approach space, whether it's as is or maybe with adaptations, perhaps with folks who have other types of mental illnesses. And then I think, one question that comes up sometimes in terms of how people cope is also, how might this play out with substance use? Because if people are anxious, for instance, they might turn to substances to be a quick fix in the moment. And also that may not be addressing the underlying issues.
Yeah, that's an interesting question. My direct experience is still a little limited for me to give like a very solid answer to this
Fair.
question of the substances. And so I said to you before we started, I don't mind saying I don't know. And this is a place where
I appreciate your honesty.
I will say I'm not really sure. My sense is that if that is the case, you probably want to be using space as part of a treatment strategy. And so maybe there's also like a chemical dependency kind of consultant who's also providing input into other aspects. And sometimes you do need to figure out priorities, meaning, yes, there's like this complex presentation, but what's our thing that we're focused on now? And maybe
Mhm.
that's the anxiety, maybe it's substances or something else. Okay, if we're talking about the occasional use of marijuana or something like that, I think that is a little bit par for the course and probably would not be a huge factor.
Sure.
But if there's some other serious addiction, at least for me, I would say I'm happy to try to work with you, but I think there needs to be additional input from somebody who just knows a lot more about that domain than I do.
Fair enough. Thank you. And so let's say someone gets started with space. I know everyone's different, but do you have any sense of what the typical time frame might be where people might start to see improvements or would expect to say, hey, it's going to be a little while. However, on average, we might see improvements in this time frame?
Yeah, I will say when we do space in my program at Yale, a typical course of treatment is often around 12 weeks, 12 weekly sessions.
Okay.
My sense is that in the community, outside of the kind of very rigorous sort of work that we do, it tends to be a little bit longer than that.
Yeah. Okay.
And so maybe it would be more like 16 or 20 sessions rather than 12
hmm
sessions. But I do think you would hope to be seeing improvement probably if you've been doing it and really doing it, not just like it's not enough to come and say we're doing space, but like if you're really following and you're doing it like 2 months in, I would hope to see some meaningful shift. And sometimes a better way to pin that is not to how many weeks from start, but to from when you actually started reducing those accommodations. Because if you did
Okay.
that for third, fourth, fifth session, it might be different than if you only started that in your eighth, ninth, 10th session. And so your clock is moving a little bit differently.
Of course.
But I would say a month from when you started actively reducing the accommodation, I would hope to see some meaningful indications that there's momentum.
Okay, great. Thank you so much. I really appreciate that. And I guess, you know, thinking about how this goes with folks, is there ever a time when someone would do space, you know, take a break and then start it up again? Like, is continuity really important? Or what are your thoughts there?
Well, I'll say this. I think some elements of space are good to do for any parent who's dealing with any anxious child at all, just like an understanding of
Mhm.
what is accommodation or what does it mean to be supportive for it. And that you can do in a few weeks of talking about it. It's not really doing space, but it is like getting some of that knowledge. You can do that and then decide what next from here. Do we want to do this treatment or not? But in terms of actually doing the treatment, I guess my advice is whatever treatment you're doing, whether it's SPACE or CBT or a medication or something else, whatever treatment you're doing, give it the best chance of success.
Yeah.
And sometimes that means a little bit more continuity and a little bit more sticking with it, even if
Mhm.
it's a little frustrating or you're busy or what have you, because in my experience, when people don't give it the best chance of success, of course, it has a lower chance of success. But
Sure.
what they tend to take away from that experience is not, I should have done it better.
Mhm.
What they actually, and this is just human nature, but what they actually tend to take away from it is, I tried that treatment and it didn't work for me.
Mm.
Then you feel like, yeah, well, that I tried didn't really help me, but maybe you didn't actually try it. But then you
Mhm.
think you don't want to try it again because, well, I tried it and it didn't work. And so my
That's a
advice
good
is
point.
whatever treatment you're doing, give it the absolute best chance of success. It's like when they give you antibiotic and they tell you, like, go to the end of the course, like,
Take the full
don't,
thing. Yeah.
you'll feel better in 3 days, but don't stop. Uh, I think that's kind of similar to what I'm saying here.
That's such a good reminder. Okay, thank you. Well, we are out of time for questions, so we're going to turn over to closing remarks now. So thank you again for folks who stayed on to the end. We have some resources at McLean to support families who might be interested. And I've heard from my colleagues in the Child and Adolescent Division at McLean that SPACE certainly has made its presence there. And so as I had mentioned, for folks who are on at the beginning of the webinar, we would really love you to take a minute to fill out our quick survey. Feel free to scan the QR code or go ahead and click on the link in the chat. And this just asks about, what you thought of the webinar, what we could make it better, and yeah, a little bit about yourself so we understand how we can best serve the communities that are engaging in our content. So feel free to take a moment to do that. And then while you're doing that, I'm going to put a growing resource sheet in the chat. So this is not an exhaustive list, but we have over the years, and usually month by month, continue to update the resources that we have available to folks. So this is in the chat. Hopefully you all can see it. It's a PDF. And if you have ideas of something that's not on the resource list that would be helpful, probably plan on adding a bit about SPACE in there for future webinars, please feel free to let me know because I always love to hear about more resources that could be helpful to other families. All right. And in terms of our people who have made this work possible, I just want to thank our team and our philanthropy support. And then our next family webinar will be Thursday, June 12th, same time, 5 to 6 p.m. And we'll be talking about building family resilience for bipolar disorder and more, because there's always more, with Dr. Emily Carroll, who is a clinical psychologist at McLean. And she'll be talking about an overview of something called family-focused therapy, or FFT. So definitely stay tuned for that. And if you have any questions for me about what we've talked about today, feel free to get in touch. My email and phone number are here. And Dr. Lebowitz, if people have questions for you, I know they can learn more, by checking out your book. Do you have your contact information available that you would care to share, or should they kind of follow up on the website that you had shared with us?
Definitely go on the website. A lot of your
Okay.
questions might be answered through there are many
Perfect.
resources on the website. It's also not hard to find me.
Perfect.
And so, my email is at Yale, and you can find me, but probably a lot of answers would be on the website.
Yeah, I'm going to put that website in the chat again for folks who may have missed it earlier. So anyway, thank you all for coming again, and I hope you have a wonderful rest of the night. And thank you, Dr.
Thank you.
Lebowitz, for sharing your expertise with us.
Thanks so much.